Good day. I am Jana Kimberly Q. Dimaon, a first-year medical student, and I will be demonstrating on how to take the vital signs, such as temperature, pulse rate or heart rate, respiration rate, and blood pressure. These vital signs are a component of patient care, which can be used in detecting and monitoring medical problems. Before conducting the procedure, make sure to start with a clean hands. A well-lit and comfortable place with complete equipments should be prepared beforehand. The equipments that we will be using are thermometer for detecting the body's temperature, alcohol pads or cotton with alcohol for disinfecting the tip of the thermometer, stethoscope, and sphygmomanometer for the blood pressure of the patient. Before doing the procedure, make sure to enter the room of the patient and greet them with respect. Excuse me, may I come in?
Yes, please.
Good morning, ma'am. I'm Jana Kimberly Q. Dimaon, a first-year medical student, and I will be taking your vital signs for today. I will be gathering information while I interview you. May I know your full name, please?
Alexa Marie Kimbao Cipriano.
Your age?
I'm 22.
And your birthday?
August 31, 1998.
How would you like me to address you?
Just call me Alexa.
Okay, Miss Alexa. I would just like to know, did you do vigorous exercise, take any alcohol or caffeinated beverages 30 minutes before doing this?
No, I haven't.
Okay, that's good. Make sure that the patient did not take any alcohol or caffeinated beverages 30 minutes before doing the procedure. Make sure that the patient is rested for about 5 minutes. Now I am going to conduct and obtain her blood pressure. When taking the blood pressure, assist the patient. Make sure that the arm is aligned to the heart and that the palms are facing upward. Wrap the cuff around her arm. Don't forget to fold the sleeves. Wrap the cuff around the arm 2 centimeters above the elbow. Make sure that the cuff is snug fit, not too tight and not too loose. This is the right way how to use the thermometer, the stethoscope. Make sure the air valve is closed. Position the stethoscope, the diaphragm of the stethoscope, onto the brachial artery. The next step is inflate the bulb up to 200 and release some air. Wait for the first and the last sound. The first Korotkov sound that you will be hearing would describe or would equal to the systolic rate of the person, while the last Korotkov sound would be the diastolic. Release. Okay. your blood pressure is 122/82. The normal blood pressure of a person is 120/80. The next procedure that I will be conducting is the obtaining or the taking of her body temperature. Make sure that the auxiliary thermometer is disinfected with the use of the alcohol pad or the cotton balls with alcohol. This aside. Air dry for a little. Press. Insert the auxiliary thermometer into the auxiliary fossa, ensuring the compression onto the thermometer. Wait for the beep and read out the result. The normal body temperature ranges between 36.1 to 37.2 degrees Celsius. Okay. Thank you. 37.1. Which means, ma'am, that is beyond, and that is within the normal range. The next that I will be performing is heart rate. Grasp the wrist of the patient and palpate the radial artery. Use your index and middle finger and compress to it. Make sure that you have a watch with seconds hands, for you will be reading out the heart rate within 15 seconds and will be multiplied by 4. Okay. Without letting go of your hand onto the patient's wrist, you may now take the respiration rate. Make sure that when you are taking the respiration rate of the patient, you should not let the patient know because the consciousness of the patient may alter the result. Do not let go with your one hand and place one hand onto the patient's shoulder, or you may do it at the back. And observe the patient's breathing while counting within 15 seconds and multiply it by 4. Okay. The normal heart rate and the normal respiration rate are 60 to 100 beats per minute, and for the respiration rate is 14 to 20 breaths per minute. More than 100 beats per minute would mean tachycardia, and less than 60 beats per minute would mean bradycardia. On the other hand, more than 20 breaths per minute would mean tachypnea, while less than 14 breaths per minute would mean bradypnea. Miss Alexa, your vital signs are already finished. Do you feel any discomfort?
No, I'm not.
Before leaving the patient or before completely ending the procedure, make sure to ask the patient if he or she feels any discomfort, because this will ensure the patient's safety before, during, and after taking the vital signs. Thank you for watching my video, and I hope to see you next time. Thank you.
10 minutes siya.